The link between diabetes and heart disease. Diabetes is not just a disorder of blood sugar regulation. It is also a major risk factor for cardiovascular diseases, including heart attacks and strokes. In fact, diabetes is considered one of the leading causes of heart disease and stroke worldwide. This increased risk is largely due to abnormal levels of fats in the blood, commonly known as blood lipids, that often accompany diabetes. Statistics show that more than 80% of people with diabetes have elevated blood fat levels, especially high levels of LDL cholesterol, the bad cholesterol, and triglycerides. These fats can accumulate in the walls of blood vessels, causing narrowing and hardening of the arteries, a process known as atherosclerosis. This is the main cause of heart disease and stroke. When arteries become blocked by fatty deposits, the heart has to work harder to pump blood, greatly increasing the risk of heart attacks and strokes. In addition, people with diabetes often face other health challenges such as high blood pressure, overweight or obesity, and physical inactivity, factors that further worsen cardiovascular risk. Combined with persistently high blood sugar levels, the blood vessels become more prone to damage and have a reduced ability to repair themselves after minor injuries. This makes it easier for blood clots to form, leading to sudden events like stroke or heart attack. Therefore, for individuals with diabetes, managing blood sugar alone is not enough. It is essential to also monitor and control blood lipid levels and blood pressure. Doing so is a crucial step in reducing the risk of serious and potentially life-threatening complications like heart disease and stroke. Key blood fat levels to monitor. For people with diabetes, regular monitoring of blood fat levels, known as a lipid profile, is essential to reduce the risk of heart disease and stroke. This profile includes several important components: LDL cholesterol, often called the bad cholesterol, HDL cholesterol, the good cholesterol, and triglycerides. LDL cholesterol is the most critical factor when assessing cardiovascular risk. For those without a history of heart disease, the recommended LDL level is less than 100 milligrams per deciliter. However, if you have previously experienced heart disease, stroke, or other cardiovascular problems, your target LDL level should be even lower, 70 milligrams per deciliter or less. Reducing LDL cholesterol significantly decreases the risk of future heart attacks and strokes. HDL cholesterol plays a protective role by helping to remove excess cholesterol from the bloodstream and preventing artery damage. In men, an HDL level of 40 milligrams per deciliter or higher is desirable, while in women, the goal is generally 50 milligrams per deciliter or above. Higher HDL levels are associated with a lower risk of cardiovascular disease. Triglycerides, another type of fat in the blood, should ideally be kept below 150 milligrams per deciliter. Elevated triglyceride levels contribute to the hardening and narrowing of arteries, increasing the risk of heart problems. Because blood fat levels can fluctuate due to lifestyle, diet, and medications, it's recommended that people with diabetes get their lipid profiles checked at least once a year. This regular screening helps identify any abnormalities early and allows for timely interventions to keep these levels within the desirable ranges. By carefully managing LDL, HDL, and triglyceride levels, people with diabetes can substantially reduce their risk of developing serious heart and vascular diseases. Benefits of controlling blood fat levels. Effectively managing blood fat levels, especially lowering LDL cholesterol, has been proven to significantly reduce the risk of heart disease in people with diabetes. Studies show that for every 40 milligrams per deciliter reduction in LDL cholesterol, the risk of developing heart disease can drop by 20 to 30% over a 5-year period. This highlights just how powerful controlling cholesterol levels can be in preventing serious cardiovascular events. Achieving target levels of LDL cholesterol reduces the buildup of fatty plaques in arteries, helping to keep blood vessels open and flexible. This improves blood flow to the heart and brain, lowering the chances of heart attacks and strokes. Additionally, maintaining a healthy level of HDL cholesterol contributes to this protective effect by helping clear cholesterol from the bloodstream. Lowering triglyceride levels also plays an important role in reducing cardiovascular risk. High triglycerides contribute to the development of atherosclerosis, which can lead to blockages in blood vessels. By keeping triglycerides within the recommended range, the arteries remain healthier and less prone to damage. Overall, controlling blood fat levels is a key component of reducing the dangerous complications associated with diabetes. It not only helps prevent life-threatening events like heart attacks and strokes, but also improves overall cardiovascular health and quality of life for those living with diabetes. Effective ways to control blood fat levels. There are several proven strategies to help people with diabetes manage their blood fat levels and reduce the risk of heart disease. One of the most important approaches is adopting a healthy diet. This includes reducing intake of saturated fats, trans fats, and cholesterol, while increasing consumption of fruits, vegetables, whole grains, and healthy fats such as those found in nuts, seeds, and fish. A balanced diet can help lower LDL cholesterol and triglycerides while supporting overall heart health. Regular physical activity is another key factor. Exercise helps raise HDL cholesterol, the good cholesterol, while lowering LDL cholesterol and triglycerides. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week, such as brisk walking, cycling, or swimming. Exercise also helps control weight, improve insulin sensitivity, and manage blood sugar levels. For those who are overweight or obese, losing weight can significantly improve blood fat levels and reduce cardiovascular risk. Even a modest weight loss of 5 to 10% of body weight can have positive effects on cholesterol and triglyceride levels. In addition to lifestyle changes, controlling blood glucose, A1C levels, and blood pressure is crucial. High blood sugar and hypertension can worsen artery damage and increase heart disease risk. Therefore, managing these factors through diet, exercise, and medications when needed is vital. Finally, there are several medications available that can help lower cholesterol and triglycerides when lifestyle changes alone are not enough. These include statins, fibrates, and other lipid-lowering drugs. It's important to work closely with a healthcare provider to determine the best treatment plan based on individual health needs. By combining diet, exercise, weight management, blood sugar control, and appropriate medications, people with diabetes can effectively manage their blood fat levels and greatly reduce their risk of heart attacks and strokes. Thank you for watching. We hope this video has helped you better understand the link between diabetes and heart disease, as well as how to manage your blood fats to protect your health. Remember to maintain a healthy lifestyle and have regular checkups to prevent serious complications. If you found this video helpful, please hit the subscribe button and ring the notification bell so you won't miss our latest health and wellness content. Wishing you good health, and see you in the next video.